Hi everybody. In this video, we're going to look at the mandible and its structures. We're also going to look at prognathism. So the mandible, there's only one. It forms the lower jaw, and it consists of two parts, the body and the ramus. The body is the horizontal lower portion of your jaw, so this part down here. This would be the angle of the jaw where the body and the ramus meet. And so the ramus is then the vertical superior portion of your jaw. You only have one body of the jaw, but you do have two ramuses, or rami as plural. We're first going to look at the structures of the body of the mandible. The maxilla we talked about last video, that has an alveolar process. Well, the mandible also has alveolar processes. They hold 16 teeth, structured much the same as the alveolar processes of the maxilla. It has, again, 4 incisors, 2 canines, 4 premolars or bicuspids, and 6 molars. So it has the same amount of teeth as your maxilla does. Now, when you compare the alveolar process of the mandible, compare it to the alveolar process of the maxilla, the inferior or mandibular alveolar process lies slightly posterior to the superior. And what that means is that everyone normally has a very slight overbite. So the teeth don't touch technically. When you close the mouth all the way, your inferior incisors will be behind your superior incisors. It also exhibits a slight gap with the superior in natural repose. Again, natural repose is the term that we use to indicate how someone looks when they're sleeping, so to speak. So the teeth don't touch normally. You don't walk around with your teeth clenched. And that's important because when you're retrieving the mandible, closing the mouth, you want to close it to the point where the teeth don't touch, but where the lips abut. So as the lips, when they touch, that's where you stop. You don't close it all the way so that the teeth touch, because if you do, the person's going to look clenched and angry, basically. Now, looking at some eminences on the body of the mandible, there's a triangular eminence that's kind of at the front and bottom part of your mandible. So the medial, anterior, and inferior portion of the mandible, that's the mental eminence. There's only one of them, and it has an impact on the inferior border of the chin. There is, if you look at the base of the mental eminence down at the bottom of the chin, it does tend to have a slight concavity. It can have a severe concavity, and so that's where you get kind of butt chins and things like that. But it will influence the border, the inferior border of the chin. It will make it look a little bit different if it's structured differently. Lateral to the mental eminence is the symphysis. So it's a faint vertical ridge that borders the mental eminence. It is along that lateral border of the mental eminence. That's the symphysis. At the ends of the symphysis, the lateral ends, are the mental tubercles. There's 2 of those. These are little prominences at the lateral ends of the mental eminence. So they're little bumps. You can feel them on your chin. If you feel your chin, you find that mental tubercle, or that mental eminence, kind of go a little bit lateral, and you'll feel mental tubercles. These do have a use, and I've talked about them in lab a lot. There's a line that we draw from the apex of the angle of the zygomatic bone, so about here. It's just kind of lateral and inferior to your eye socket, and you draw a line from there to the mental tubercle. So it's not going to be a straight line, but I'll draw one. So from here to here. Okay, again, like I said, I can't draw a straight line with a computer. But that line, we use that in restorative art to show the change in direction from the anterior plane of the face to the lateral plane of the face. Or you could even say the anterior portion of your cheeks to the lateral portion of your cheeks. It shows direction change of the face. Now, between the mental eminence and the lower teeth is the incisive fossa. It's a little recession between the mental eminence and the incisor teeth of the mandible. This causes a recession of the inferior integumentary lip. So this little dent right here between the chin and the lower lip, that's caused by the incisive fossa. Okay, those are the structures of the body of the mandible. Now we're going to look at the ramus of the mandible. Again, there are two of those, and they both have the same parts. The posterior border of the ramus, so this part back here, that will indicate the posterior border of the cheek. So back here shows that. It will also, if you draw a line superiorly, it will indicate the anterior border of the ear. So you could theoretically use this to place an ear. It's not the best thing to use, but you could. The anterior portion of the ramus, so this part up front, which on this picture of this lady would be about here. Okay, so kind of the posterior portion of the cheek. That is covered by the parotid gland. The parotid gland is a salivary gland. And it's important to remember that because when people lose weight, like get really thin, you'll see their cheeks get kind of hollow. That's because the anterior portion of the cheek, so this part here, is covered by what we call the buccal fat pad. And so if you lose a lot of fat, that buccal fat pad will start to disappear. So your cheeks get thinner. But your parotid gland may shrink a little bit especially if you're emaciated, but not too much. So the posterior portion of the cheek tends to keep some convexity, so it tends to keep some curve to it. Whereas the anterior portions of the cheek, where that buccal fat pad are, those can actually start to become more concave even if you get real thin. So some other parts of the ramus would be the coronoid process. So if you look at the top of the ramus, there are two projections. There's a posterior one and an anterior one. The coronoid process is the anterior projection on the superior ramus. That coronoid process is the insertion point for the temporalis muscle. Talked about the temporalis muscle in the last video a little bit. It originates up in the temple, passes through the infratemporal fossa, which is between the zygomatic arch and the squama, if you will, of the temporal bone. That muscle goes through that space, that infratemporal fossa, and inserts in the coronoid process. That's kind of the main muscle of mastication is the temporalis muscle. It's the strongest muscle to close your mouth. The posterior projection of the superior ramus back here is the condyle. Condyle is kind of a general term that means joint. You have condyles on your femur, you have condyles on your humerus, but the condyle is where the mandible articulates with the temporal bone. So it's the articulation point with the mandibular fossa, I should say, of the temporal bone. That mandibular fossa was that little dent in the temporal bone, and the condyle fits in that, and that's the joint for your jaw. If your jaw becomes dislocated, this condyle has popped out of joint, and they'll pop it back in, which apparently is very painful. The last structure we're going to look at is the angle of the jaw, or angle of the mandible. Both is correct. That's just where the body of the mandible articulates with the ramus of the mandible. And the angle of the jaw has a pretty big impact on how your face looks. So it has it is one of the things that affects the anterior geometric form of your head. And that has to do with how long the ramus is. So if you have a short ramus, you have narrow jaws, like this one on the right. That would be a very short ramus. You don't really see the angles of the jaw too much from the front because they're very high up. Whereas the one on the left would have a very long ramus because you can see the angles of the jaw almost level with the chin. We'll talk about these angles of the jaw and how they affect not only the anterior geometric form of the skull, but also the profile view of a person's face in a later section. Now, the angle of your jaw will actually change throughout your lifetime. At birth, it's about 175 degrees, so it's very short. It hasn't grown very much, mainly because you don't have any teeth, so you don't need to make room for them. But as you grow, it will start to go more towards 90. So at birth, it's 175. At your first year, it's about 140 degrees. So again, it's starting to become more, move more towards 90 degrees. As an adult, it can range between 110 and 120. In old age, that angle can go back to about 140 again if you lose your teeth. So this is my nephew George. This is when he was a baby. You can't really see much of a jaw on him, mainly because he's very chubby. As he grows, though, you can see that his angle of his jaw is kind of moving down a little bit, the ramus. And this was him at about 2 or so. And again, you can see that that ramus has grown considerably. Next, we're going to look at prognathism. Prognathism is anytime the lower portion of your jaw, or your jaw, I should just say lower portion of your face, sticks out. If it doesn't stick out, that's called orthognathus or orthognathism. That's when your profile is straight from your forehead down to the upper lip. There's no projection of the jaw. Prognathism is when there's a projection of the jaw, whether it's lower or upper, beyond the superior part of the face. It causes some problems with eating. It also causes problems if you're setting features with setting the lips. Now, how they determine if somebody has a prognathism is something called the facial angle of Camper. The facial angle of Camper is an intersection between accesses of the face. So what they do is they draw a line from the most prominent point of the frontal bone to the alveolar arch of the upper jaw. So basically from your forehead to your upper lip, that vertical line. And then they'll draw a horizontal line from the ear passage to the nasal spine. And so what that creates is a 90 degree. If it's 90 degrees, then you're technically orthognathic. You have orthognathism. You do not have any projection of your lower jaw, or lower face, I should say. If there is an acute angle, so some part of your lower face is pushing out, that makes an acute angle. Acute just means less than 90. It makes an acute angle in this area up here. And so that indicates prognathism. Now, there are different types of prognathism. There is maxillary prognathism, and that's when the upper lip projects. Again, that could be due to some malformation of your maxilla. That's why they call it maxillary. It results in an overbite, and usually the lower lip and chin will look to recede away from the face. There's mandibular. That's when the lower lip and chin project beyond the upper lip. That would create what we call an underbite. There's alveolar prognathism, in which the lips move forward to meet while the chin recedes. Duck lips is how I tend to describe it. I have a cousin that has duck lips. He has alveolar prognathism. So his lips just kind of purse out a little bit. You can have dental prognathism, and that has nothing to do with your jaw. It has to do with your teeth. Your teeth are obliquely inserted, meaning they are set at an angle. They're not going straight up and down. And so that will then make your lips stick out. That creates the acute angle in the facial angle of Camper. The last type of prognathism is the infranasal prognathism, and that's when the nasal shaft has a greater angle than normal, inclining forward. And so that kind of pushes your lower jaw out a little bit. Now, there's a condition that is oftentimes associated with prognathism called buck teeth. Buck teeth is just a condition in which the lips don't meet. Now, it could be due to alveolar prognathism. It could be due to maxillary or mandibular prognathism. Most people associate buck teeth with a maxillary prognathism, where your upper lip sticks out too far. But buck teeth, as in this kid here, does not necessarily indicate a prognathism. Some people lips just don't touch. And they talk a lot about, fixing buck teeth, quote unquote. But there is no fixing it. That's how the person looks. The main thing with buck teeth is you just make sure the teeth are clean, because that's how the person always looked. So that finishes it up with this video of bones of the face. The next video, we're going to start covering muscles of the face.